There's a lot of emotional weight to any time you do an operation, particularly on a child. And that's heightened in the situation of living donation because you have two patients.
We're forever thankful for her and to her. Because of her, our daughter, she has a chance.
Living donation is critically important for our liver and kidney transplant programs. And the fundamental problem with transplantation in general is that we have far more people who need a transplant than we do organs available from deceased donors. A good analogy for this is when you've been to the airport and you know there's an extremely long line of security. We've all waited there and been nervous that we might miss our flight. But if you have a TSA pre-check, you get to go straight through the line, go through security, and you make your flight every time. And that's what it's like when you have a living donor. When you think about kidney transplant, the problem is that line for security is extremely long. We have over 1,000 patients at our hospital on the wait list, and that wait time can be 5-6 years plus. And the problem is a lot of people don't make it through. The analogy would be 50% of those people don't make it through security to catch their flight. But if you have a living donor, you go straight through and you know you're going to get transplanted. And for liver transplant, we have something called the MELD score. And the MELD score determines how sick you are from your liver disease. But the problem is there are some people who are very sick but do not have a high MELD score. And they're stuck in that line to get through at the airport. And people keep cutting in front of them. People with higher MELD scores will cut in front of you and you never actually get through security. Again, if you have a living donor, you're on the fast pass lane and you're going straight through security and you're getting your transplant. Lots of people can be living donors if you're a generally healthy person. For kidney transplantation, we have a broad age range of people who are eligible for donation. The general criteria is that you be healthy and not have risk factors for developing kidney disease in the future. And also to make sure that the operation is done safely, we want the donor's weight to be in a relatively normal range. We have a BMI cutoff of around 30 to 32, but we're happy to engage with donors of all ages and sizes to help them meet their health goals. For liver transplantation, the operation is a little bigger and it's a little more complex. The age range that's acceptable goes from 18 to 50 years old and a BMI range of under 35 to be evaluated for transplant and typically below a BMI of 32 in order to proceed with the donation surgery. The main concern there is fatty tissue within the liver, which can happen when you carry extra weight. The number one priority is safety. Each operation is very carefully planned to make sure that it's executed so that it's safe for both the donor and the recipient. For a living donor kidney transplantation, a kidney is removed through a minimally invasive robotic-assisted approach. Now, in the age of AI, the robot does not do the operation by itself. The robot is a tool that is manipulated by a surgeon to do the surgery through 3 small incisions in the abdomen, with a slightly smaller incision in the lower abdomen that we use to extract the kidney for transplant. For a living donor liver transplantation, there's much planning that goes into understanding the inner workings of the liver. The biliary anatomy, the blood vessel anatomy inside the liver is carefully mapped. And then we divide the liver through an open operation, which is an incision that goes from underneath the breastbone down to the umbilicus or the belly button. We can do the operation through this relatively small incision, split the liver into 2 pieces, and remove the piece for transplant. With living donor surgery, the recovery in most cases is actually very predictable. With living donor kidney transplantation and a minimally invasive approach, over 85% of donors go home the day after surgery, so that's just one night in the hospital. By 2 to 3 weeks, they're back to normal light activity and typically able to return to work by 4 to 6 weeks. For a living donor liver transplant, the operation is a little bit bigger. The hospital stay is typically around 4 to 7 days. And again, usually by 2 to 3 weeks, back to normal light activity, off of any prescription pain medication, and able to return to work in the 4 to 6 week time frame. Children, pediatric recipients of living donor liver transplants is a very important group. Children who have end-stage liver disease are disadvantaged because of their very small size. With living donor surgery, we can carefully plan the operation, remove a much smaller piece of liver from the donor, and transplant into the child before they get sick and are at risk of dying. One of the most profound examples of this are donors that have come forward and be willing to donate to a stranger. We call them anonymous or altruistic donors. And these donors can register with our program and be available to donate part of their liver to save a baby's life.
She was yellow, her stomach extended, her gallbladder didn't work.
She was born with a condition known as biliary atresia, and that means that the very small bile ducts in the liver don't form normally, and so the bile that the liver makes can't get out.
They took the gallbladder out and put her intestines and pinned it right there so they'll have a straight, direct flow of bile, and that got her by until we found a donor.
I had a friend of mine. He wound up needing a kidney, and we were not a match, but I was an eligible donor, so they went ahead and paired us. My kidney went somewhere in Texas, my friend got his kidney, and I found that there are several people in the United States that have donated twice. Felt like a divine inspiration to look up to see if it was possible to donate a liver. Dr. Seal was all over it, and we got tested. And we were a match. They paired us right after the testing almost immediately.
My partner, Dr. John Seal, did the donor's operation. I did the recipient's operation. For a small pediatric recipient, we only have to remove about 20 to 25% of the donor's liver. This is not exactly to scale, but the portion of the liver that was transplanted into Malaya was the left side over here, so roughly the liver was divided down the middle. It's a very complex surgery, but everything went very smoothly.
I didn't know who I was donating to. What if she doesn't like me and she starts crying? Hi. Oh my goodness.
Hey, what's your name?
I'm Stephanie.
How you doing? Thank you so much. How you recovered?
Great.
That's
Yeah,
great.
they did a phenomenal job.
Yes, for her too. It's almost completely healed on the outside. So.
Same. I'm blessed. This is my honor. And she's precious. Unbelievable, adorable.
The average kid who does not get a transplant or even the Kasai procedure, they don't make it to the age of 12.
Except like in her eyes, like it was yellow, her skin was yellow, and like you don't even see any of that now, like at all.
The segment of liver that Malaya got will grow throughout her life, and so if things go the way they typically will, she should have normal liver function for the rest of her life.
She loves the outside, and she takes note of everything, every little single thing. So I really think she's gonna be a little explorer, her. Yes, maybe travel the world. Yeah.
I hope she has big dreams, and I hope that she is able to carry them out.
So we're forever thankful for her and to her. Because of her, our daughter, she has a chance.
I'm very glad to be a part of this, and I thank you guys.
The greatest challenge we face in our field is that there simply aren't enough organs to go around to transplant everyone.
I think more people would do it if they knew it was possible. So worth it.
Reach out to us through the links below to contact a living donor kidney or living donor liver coordinator. There they can get additional information, speak directly with a coordinator to ask their questions, or even fill out a health questionnaire to start the process.